Yeah, man, I'm trying to do iPod. My office, the office though, I got a little bit of maneuver on with that one. iPod.
Am I supposed to kick us off, Daniel?
Uh, oh yeah, wow, it's already two. That came out that can I so quick. Okay. I have ownership now, so I want to make sure if there's anyone I need to promote in here. Looks like Tamara needs to be promoted. I'm not sure who Beautiful Existence is.
I think that's Bella.
Oh, okay. Let's see, promote. And then Catherine, did you want to be promoted or observer or just checking in?
I'm just an observer.
Oh, I see. Okay. Okay, everybody, just gonna wait a minute or two more. See who we've got joining.
I emailed, but I have to leave today between 2:50 and 3. I'm really sorry. I have a second job now, and I am working to make sure that this won't happen again, but today I couldn't avoid it.
That's quite all right, Ben. I think I buffered in some extra time on the agenda items. I tried not to pack it too heavy. And we're really just focusing on 2 or 3 things here today.
Great.
And I don't you won't miss much, and we'll have a recording and there'll be notes.
Is Christina here today?
Let me see if I got a message from Christina. She was out. She wasn't available Monday.
Oh, I see. I think I see her in the attendees list.
Is she now in the attendee? Did she just? Oh, there she is. Great. Okay, great. Okay. Christina, if you can hear, I am promoting you as a panelist. And that was kind of, I don't know if it was not, if you're not able to select it, but I did enable you to talk. So just, if you want to do a mic check, Christina.
Can you hear me?
I can, yeah.
Good, you got me. Great.
And I'm trying to promote you to panelist, but I don't know exactly what's might be happening on your end.
That doesn't come up on a screen for an 88 computer.
It doesn't, okay.
No, it does not.
Now
But you got me in.
your audio is working just fine for me.
Great. How many people do we have?
We have Ben, Ruby, Tamara, you, and we've got 3 attendees.
Great. Well, I have for our agenda, and I apologize, my diabetic sensor's going off. I want to go ahead and go around with a round of introductions. I'm Christina, and I am the remaining chair for the SBC. For those who do not know, Bella is leaving the Continuum of Care Advisory Board at the end of this month, and so she will no longer be the co-chair. So we're looking for additional members to possibly stand up. Otherwise, I've got it for now. And go ahead and introduce ourselves. Or at least say who is here.
Should we call for a roll call? Is that what you're?
We've never done a roll call in here.
I think we recently started doing them, if I remember correctly. I could be wrong.
We do have roll call, and I can start that for us. Let's see. Just 1 second. Okay, today is July 16th, 2025. It's 2:06 p.m. This is the System Performance Committee, a subcommittee of the Continuum of Care Advisory Board. I'm Daniel Ramos, he, him, Data Asset Manager for KCRHA, and I'm going to go through roll call. Get us started. Tamara Dahman.
Here. Here.
Sherry Tillman. Ruby Romero, Tuesday Romero.
Here, thank you.
Marvin Futrell. I see Marvin. Christina Sawicki, you are here. Frank Scott. Ben Bagan.
I'm here. It's Vaughan.
But as soon as I said that, I knew thanks, Ben. Victoria Kwan. I think I saw her. And then I did Bella Irons.
Yeah, Bella is the attendee that we were wondering if they were the attendee or not. They said they
Okay.
were going to change their settings, but
Let's see. How's that? Okay.
Do we have a quorum?
I'm checking now, Ben.
Oh, sorry. I thought you were done.
Mustafa. I don't see Mustafa here. I talked to Mustafa on Monday, so maybe he didn't say he wasn't able to join. So I'll leave that blank. So right now, we have 1, 2, 3, 4, 5, 6, 7. 1, 2, 3, 4, 6.
And Sherry's here too.
Yeah.
yep, Sherry just got here.
Oh, great. Okay. Thank you. Sherry Tillman.
Here.
Great. So that's 1, 2, 3, 4, 5, 6, 7 members. We do have quorum.
Is that including Bella? Sorry to interrupt.
I am including Bella on that.
Okay. And thank you.
Is that okay? Is there?
Mhm.
Yeah, okay. So with that, yeah, we have quorum. Thanks, everybody.
Okay, I would like the other people to also introduce themselves. You said there were 3 other people.
Oh, yes, we have our representative from our BitFocus admin team, Melissa and Lauren.
Hi, everyone. Good afternoon. My name is Lauren Searles. I use she, her pronouns. I work with BitFocus, and we work directly with KCRHA to implement the community's HMIS instance of Clarity Human Services. I'm also here with my colleague, Melissa.
Great,
Hi,
thank you. Go ahead, Melissa.
Oh, Melissa Sutton here. I also work for BitFocus. I serve as the community administration team manager. I use she, her pronouns, and we are just here to support.
Great, and I see Shauna.
Okay,
Hi,
great.
my name is Shauna McMahon. I'm Executive Director of Emmanuel Community Services. And
Welcome. Great.
I don't know who else has gone or hasn't gone yet.
No, that's perfect. I want to make sure everybody introduces themselves because as visually impaired person, I don't always see who's there. Next, do you want to go ahead and Daniel and do the land acknowledgement? I can't read that stuff.
Yeah, I'm happy to do it, or if you're, oh, Janelle, I see, oh, Janelle, yes, Janelle.
I haven't introduced myself
Yes, Janelle,
yet.
it's me too. Sorry about that.
Hi guys, Janelle Rothfolk, she, her pronouns, and the Senior Director of Research Data here at KCRHA. I'm here to do the admin support for Daniel, so I'll just be kind of taking notes here.
Thanks, Janelle. Happy you're here. Glad you're here. Did anyone want to take the land acknowledgement? I did put our template in the chat, so if not, I'm perfectly happy to read it. There's no volunteers.
Tamara.
I could, sorry, if Tamara wants to do it, go ahead, Tamara.
Oh, sure, I'll take it. So land acknowledgement, the King County Continuum of Care Board acknowledges that we work on the unceded traditional lands of the Coast Salish peoples, especially the First Peoples of Seattle, the Duwamish people, the original stewards of the land, past and present. We honor with gratitude. Oops, sorry, I am having trouble scrolling. This is the, my apologies. Okay. We honor with gratitude the land itself and the Duwamish tribe. This acknowledgement only becomes meaningful when combined with accountable relationships and the informed action, and is the first step in honoring the land that we today sit on and their peoples. Thank you.
Thank you.
Thank you, Tamara.
Next, I'll go ahead and public comments. Do we have anybody besides board members and BitFocus and staff for public comment? Seeing none, we could also open at the end if people, for a few minutes, if people then have comments. Move to the co-chairs board updates, and I would actually like Ruby to give a couple-minute update to what is going on with the COC board in general, if she wouldn't mind.
Yeah, sure. Thanks, Tamara. Hi, this is Ruby Romero, the co-chair of the Continuum of Care Board. So we do have a few updates that's been going on. I think the last time we met, we just had our convening, so we didn't quite have our counts back yet as to how many people came to our meeting in person. And I just wanted to give everyone an update. We had 75 in-person attendees and 48 virtual. So that's a great turnout. And we had a really great presentation on the Pathways to Housing Security report and how we can integrate some of those into our current system. And so that was a really great experience to see everyone in person, and we hope to do that again later this year. We also had at our last meeting, we did we got a NOFO update and a debrief from Kelsey Beckmeyer, who prepared us that we might be doing a 2025 NOFO as it's seeming. We're getting reports back from other COCs that they are also going to be entering into a NOFO process this year. So we'll see how that turns out. As of right now, we're going to just keep waiting until we hear what we need to do, but preparing in the meantime. I'm not on that work group though, so hopefully we'll get an update from that soon. We also heard about the system performance measure number 3 from Ben, who we all might be familiar with on the SPC here. And then we also did a update on the 5-year plan. We got to meet Kiki Cervantes, who is a newish member at KCRHA that we haven't gotten a chance to engage with, so that was nice to do so. And we also discussed a little bit of a letter that we are trying to draft and send out. It's looking like we are going to have that at our next meeting, though, in full transparency. There was a little misunderstanding there. So we will be updating people on that at this next COC board meeting, which is going to be the first Wednesday of August, which I believe is the 6th. Hang on, I'm almost there. I always forget to put the date down. I apologize. Yeah, it's going to be the 6th, and at 2 p.m. to 4 p.m. And then we also have the cross-cutting policy work group coming up, where we're doing some gaps analysis on our written standards, and that's going to be on the 28th of July. So that's a Monday. Thank you, guys. That's, unless I didn't capture anything, Christina, that you wanted, that's the end of my update.
And Victor's group's update?
The charter revision work group.
Yes.
Yes, so the charter revision work group is meeting this Friday. We're making some progress on the actual language of the document. This Friday, we're going to be looking at the committees and work groups and how those are kind of sourced. So lots of good work getting done there. We're going to be keeping a close look on our timeline, so we will have it by the end of the year for our next convening. But I also hope that we are taking the time to really consider what's going into the charter and everything like that. So, and I promise you, as a member of that committee, I can say that I will do my best to keep updating everyone on the progress of that document. Thank you.
Ruby,
Great, thank you.
could you, I know sometimes we get a little acronym heavy. Just a few words of what NOFO means for some of the newer members. And then Janelle, I saw you had your hand raised. I didn't know if that was an artifact, so I lowered it. Sorry about skipping you earlier. I'll get about that.
I just have a clarifying question for the notes.
Sure, go ahead.
Ruby, you mentioned a letter. What could you say a little bit more about that?
Sure, yeah. So the letter initially was discussed because we being myself, Dorsal, and I think a couple KCRHA staff were there as well at what's called a COC peer sharing group, where there was different groups sharing their experience of writing a letter to Congress, which could be considered lobbying only if you are advocating for a specific program. And so that's kind of why we had a deep discussion on what is and what is not lobbying versus advocacy. I did some research on that and just making sure that we're following the statutes for that, as it is a part of our grant agreement. And also it has quite a hefty fine if we did do something, inaccurately, and that's on the person that does that. So I don't want to pay that money personally. So we are definitely making sure that no one's going to be in a position that is considered lobbying or advocacy. So, but we do want to say what is important about the COC program to King County and Seattle as a board, and for the membership, we felt it was important to communicate exactly what the COC program is doing and why it's beneficial to our neighborhoods. Does that answer your question? Cool. And then
It
NOFO.
does. Thanks, Ruby.
Yeah, no worries. Thanks, Janelle. Thanks for asking that. The NOFO process, which was an acronym, stands for Notice of Funding Opportunity. It's the process in which we apply for funds, renewal funds, and possibly new funds if there are any available to HUD as the COC. So collaborative applicant is the KCRHA, and they help us collaborate to submit an application, and that process is called the Notice of Funding Opportunity process, or NOFO.
And the only other committee that started this week was the Point in Time Committee. And we laid out our plans for the next couple months, and really just got to know each other. Anything else, Daniel, for the updates that you think we need?
Sorry about that. I don't have any updates on any of the other subcommittees.
I do. I have one more. I forgot. I'm so sorry. We got a new co-chair for our coordinated entry committee, and so I wanted to say congratulations to Jaja to clenching that position. So thank you. Sorry about that.
That is great. Next, Daniel, if we can move to the 2025 mid-year work groups survey results.
Yes, I want to say first, thank you for everyone that filled that survey out. I'm gonna give a short presentation on that really quick and kind of just walk us through kind of the results of that and then the next steps. Let's see here. are you all able to see my screen? Not yet. Okay.
Y'all, I'm visually impaired, so I won't be able to respond to that very well. So can you guys see it or?
Yes, and
We can see it
Christina,
now.
I
Yeah.
have a rich text format for you. I can send it now if you'd like. I apologize. I was going to send that beforehand.
Thank you.
I also wanted to clarify whether or not Bella was in the meeting, because I don't think that they are able to unmute.
Oh. Let's see. Okay, I'm gonna stop sharing and see what's going on there. I just promoted you, Bella, to panelist. It says you're rejoining as panelist. Did that work?
Yes, thank you.
Oh, great. Okay. Sorry, Bella. Did you have anything that you wanted to bring up or before we move on?
No, thank you.
Okay, how's that looking? Thumbs up, some feedback.
Yep.
Can folks see that? Okay, great. This was talked about in the last month's meeting. This is the checklist that this is in regards to the oversight checklist that HUD gives us on the areas in which HUD expects us to review each year to give that oversight to the HMIS lead, which is KCRHA. And I just want to say that that's a little confusing for those of you who may go to the HMIS lead meetings or may have an HMIS lead at your agency. HMIS lead is loosely used to describe, or it is used to describe those at each agency and the providers we work with and fund at KCRHA who are our contact points for data collection through the homeless management information system. The HMIS lead entity, very similar name, is a designation by HUD that gives us the authority to manage the HMIS in concert with the collaborative applicant who manages the funding administration, and we handle the data administration. And with that, HUD gives us some key areas of compliance to overlook and for this committee to oversee. And I sent out from our last meeting, sent out a survey with those different focus areas, asking each one of the committee members to take that survey and let us know which areas of they would like to work on. And so not everyone was able to fill out the survey, but I did get quite a few of you all. And I'm hoping that today we can go over that. For those that didn't fill out the survey, we can like quickly get you tacked onto one of these areas if you'd like to. So I'm going to go through the results of that survey. Well, not really results. It's not a survey like that. It was kind of what areas do you want to support? And when I looked through that, for those of you that did do the survey, most of you put multiple areas that you'd like to help with the oversight of. And I went through that list, and without having anyone repeat it, I am recommending a lead for each one of these sections. And this is a discussion point here. So for example, I know Victoria's not here today, but Victoria selected 3 categories and other folks selected multiple. And I wanted at least one person as lead. And so kind of looking at this, I know Marvin's not here and Victoria's not here. For those of you that are, for example, Sherry, you said that you were interested in the software and vendor monitoring and coordination oversight. I guess I'm looking for confirmation that those I have in the lead category, you're good with that. And what that would entail is a one-on-one with me to start and to kick off and go through the sections and the expectations of the things that we need to review and get from a no to a yes that we reviewed it for this year. Opening it up here for discussion. If you see your name, please ask a question. Ruby, please.
I know I am one of the bad kids that did not fill out the survey. So I will just say, if there is any open room to let me know which one, it looks like there might be a strategic planning, participation, growth, and funding diversification, which always interests me, but just throwing that out there, unless of course somebody else wants to take the lead on that.
I actually, well, I'll wait till others, see if there's anyone else with the comment. I think it's a great idea, Ruby. I think there are some parts in that checklist asking, you know, what are we doing to manage growth of the HMIS, and what are we doing to secure funding for our data collection vis-a-vis the HMIS. I think you're in a good spot on the COC to bring the to understand that section, that focus area, and then being in the role that you are, that information sharing. I think that's great. Ashana?
I'm just happy to serve wherever you need me or think my skills would be best used.
Thanks. I don't have somebody for the annual HMIS user survey. That's kind of the last holdout. May seem like it's not as wordy as some of the other focus areas, but it's really important, and wanted to get started early on that. And this is, I think, Shauna, this could be, you know, something that would be really good. I know we've had some side discussions about HMIS use. I think this could really get you very familiar with, you know, what users are saying about HMIS, past surveys, and areas of improvement.
Okay.
And this is done at the end of the year. We send the survey out fourth quarter, usually November. And so we've got a pretty good runway. I think this would be good. I think this would be good. You would get exposure to a lot of the different areas of HMIS.
Okay, happy to help.
Daniel?
Yes, Ben.
I trust you, and also I'm not a data person. I mean, we talked the other day, so if you think I'd be good at that, I don't know exactly what it entails, but I am really good at hiring people that are good at data.
Okay, that's good to know. Well, Marvin's not here. We could switch you out with staffing capacity management.
I feel like that is what my master's degree is in and what I maybe more excel in, but I'm not throwing my weight around here. I just, when I see my name and then I see data on the same line, it makes me a little nervous.
No, that's perfect. If you feel like that's where your strength is, love putting people in the position where they're like able to use all their skills and knowledge. So let's do that. Janelle, are you able to take that note that we're going to swap Ben and Marvin, please?
Are we, sorry, are we able to participate in more than one if needed, or this is just a lead person?
Really good question. So now that I've got you all committed to a section, I'm going to show you that you couldn't ask that question at a better time, Ruby. I'm going to show you kind of the workload summary of this. This is really high level, but to answer your question, yes, I think we're going to want some rotating members on some of this, because you can see the volume of the things that we have to review. And most of these, I talked about it last month, most of these are questions that are going to be really easy to answer. Some of them are like, do you have a charter for your system performance committee? Yes, we do. Should it be, could it have areas of improvement? Yes, it can, but yes, we have it. And that's a yes. And then that's a green for that section. So it's almost like a matrix. Do we have it? Do we not? I'd like to thank Janelle. She's here on the call over the last 3 years. all of this has gotten from a no to a yes. And really, we're at the stage of where are the improvements that we need to make on those documents and reviewing which ones we want to read through. We would read through them and say, this looks still relevant. Great. Yes, on this. So it's less about creating new things and just reviewing the stuff we already have. But you can see here breaking it out by those areas of focus where the highest volume of review needs to happen. And in that regulatory compliance and governance section, we have the most things that we need to review. So to answer your question, Ruby, I would say we should direct resources to the higher volume areas to make sure we get that done. And then I think with one or two people, myself working with, if it's only one of you on like the staffing capacity, Ben, I would work with you. It'd be you and I, we'd go through those together. So I would be like the co-pilot for the ones that we don't have someone rotating through. I'll stop there. Ruby, is that aligning with what your thinking was here?
Yeah, I just wanted to make sure that the people that aren't here today do get to like speak up if they wanted to be involved in certain aspects. Just holding space for that. That's all. Thank you.
And this is Christina. Daniel has sent it out a couple of times now. So we, in our group, we have gotten those emails.
Oh, okay. Nope, 10-4. I agree with you then there. Thank you for that.
Yeah.
More the merrier. The more the merrier. I mean, in a perfect world, I think all of you would know all of the areas of the HMIS really, really well. It's a lot to know. And so I think setting us up for success is one or two people's, maybe a floater or rotator, kind of getting a general overview. I think that's a great idea. I think each one of us being really strong in each one of these areas is really going to help us so that we don't lose sight of some of the other pieces that go into the HMIS. So hopefully that resonates with you all. I think it would be good for us at least to have one person who's a core overseer on this on the committee, and then other support. We can all like support as needed, you know, if we need more people in a work session or something.
This is Christina, kind of, but I need to get a printed copy of this. And I know Catherine was going to help do that, but maybe she's been busy. You and I can meet up and I can get a copy of that whole document.
Absolutely. Yes.
Thank you. And if anybody else needs one, please let us know.
Janelle?
Just noting, I see Sherry's hand up.
Oh, thank you. Sorry, Sherry.
You. So no, I'm really happy that you're going to be working with me, because I felt a little intimidated with my name there, and I'm like, oh my God, by myself. So appreciate that. And then yes, I do want a copy of that as well. And then I guess I'm trying to follow. So just so I have clarity, so you're scheduling like different times to work with us on these
Yeah. What I
okay.
wanted here today was confirmation that people were tentatively good with this, and then I'm scheduling one-on-ones to go over the specifics of each one of these items.
Okay.
Areas here, and they each come with a checklist.
Okay.
So I hear you on like, it seems overwhelming and maybe intimidating. I'm gonna be here through it all, supporting each one of you in all of this, and to help answer questions. And I think once you see that checklist, I know I showed it last month. When we meet in our one-on-one, we'll go through the checklist together in more detail, and then you'll start to get a sense of what each section is. And I've sent out the links to the HMIS lead checklist, and I can put it in the chat here after I close out this presentation, so you can look at that in more detail. But I did synthesize most of the content into kind of this graphic, and then just kind of a refresh on what it is that we're doing here with this exercise. So we're checking for compliance. That's the role of this committee, is to make sure that we're meeting all of our baseline activities that we're supposed to be doing throughout the year. And then through this, my hope is that you will learn the different facets of the HMIS and its functions. And together we'll all be able to continuously keep an eye on these different areas as we move forward in time. And we'll get and the end goal is we'll get all of this done by the end of the year. We'll be proud that we did the oversight for the HMIS and we got through the entirety of the checklist. And then anything that is left over, we could carry over into the new year and just continue to do that review and improvement. So this isn't a one and done. This is a continuous process for us. I can be a little bit wordy on that, but I think you can read the slide here, and then that graphic is really how HUD encourages us to see this work. And then Janelle?
Yeah, Danielle, I really like how what you have on this slide. I think it would be worth just going ahead and reading through this slide for everybody. Just take some time to digest it.
Yeah, I'll read it. I know that's a little boring, but I will read it. So the HMIS lead improvement evaluation matrix, which is those focus areas, it helps the System Performance Committee oversee the HMIS lead operations. So what I do, what Janelle does, the data management team, our analytics team, all of those roles wrap up into the work that we do. And this clarifies those expectations around the compliance around how we operate the HMIS, and that we're doing everything that we're required to by HUD. And that's data quality, system administration, those key areas, training, staffing, and planning. And then, highlighted there, the goal is to support continuous improvement. Like I said, we're not just doing this for show. We really want to improve our system. And then for you all, you'll be able to use that matrix to review the HUD requirements and what they prioritize in there. And then you're working with me directly, which is really nice, because as we identify things, you're talking to the HMIS lead team, Janelle, myself, and others on there. We have a direct channel to areas that we identify that we know may need to be, we may need more detail in a policy or tweak some activity. You'll be able to learn that through this monitoring process of going through the checklist. And then really the idea here is that these improvements result in actual system improvements on how we collect data and how people experience the data collection process, both at the provider level and in a person-centered way. How are they experiencing going through the system and having to do assessments and things like that? So we get the checklist gets really granular in some of those things, and then some of it's just a check mark on, do you have this charter? Yes or no. And then that last sentence here, the intent is to strengthen system performance in service of the community's homeless response system. Sorry, I forgot a word there. And then the diagram there is the act, plan, do, study. So how do we improve performance of our HMIS based on our monitoring process? That's the act once we know. Actually, I'm starting out, sorry, in the wrong quadrant there. So plan, what changes are needed, who is responsible. So that's what we're doing today. We're looking at the checklist and who is going to lead that effort. And then the do, what is being done. When we look at those documents and the things that we ought to be doing, strategic planning, growth management, what are we doing to improve that? So we'll have a section where we can put notes in on if improvements we can't make in 2025, what would we like to do in 2026? And then the study part, which is the results of this. And I think this is the exciting part for me, is once we get this checklist done and we all have a collective shared understanding of it, really what do we think is the health of the system? What's our overall sense of where we're at? And then where do we need to go, which is that act piece, which is now that we've collected that information, we've got it all there, what do we do next? And I didn't know if we wanted to get into this now, but I think there is room for maybe like a one-page summary at the end of this, that we did it, things we learned, areas that we know we need to improve. I'm still kind of brainstorming. I think that's something I want to engage you all in. once we finish those different sections, what do we want to do as our end product? Is it a presentation? Is it just saying, call it good? We did the checklist. We're exhausted, but we did it. Or is it a kind of a final, 1 or 2 page report on it that maybe goes to the COC? And I'm opening that up to discussion. Ruby, I see your hand is raised.
My brain is already turning on this portion right here, Daniel. Thank you for asking that question. I would, see what others would be interested in as well, but I think that this is one of those successes that like we could really promote as a communicating tool as to like, this is what the benefits of having a system performance committee and the continuum of care board and all these other various parts of programs that are being, potentially targeted right now at a higher level of government. And so just trying to hold space for like, maybe we could have that, 1 or 2 page, depending on how much substantive information goes into it. And I would like to see, a presentation to the COC board and then maybe a presentation of the governing board as well to promote, this is what our systems are actually doing behind the scenes or, around the area, right? Because like, I think that this is an important thing and we're really taking a time to go through this. This is the first time we've done this to this extent, I think. So just excited to see where it goes. If there's something worth telling them, of course. If there's nothing worth telling them, then what are we doing? But I think it would be interesting to see what we get out of this and where it could go. Yeah.
Yeah, I like that. And I would just, as we go through that, I would say just, keep in mind, Christina as our co-chair and, as, our guide through this committee, and really trying to present, I think, to our co-chairs here, what are the final products that we want to put together and based on capacity and resources, what makes the most sense. But I'm on board with that, Ruby. I like aspirational, like, and maybe if we don't get maybe we get a presentation in the COC, maybe next year we expand to governing board or all of it if we can. I also kind of want to always balance, like, I know this is a volunteer committee and people have to take time out of work, and I want to respect the realistic resources right now of people as well. But I love the aspirations. I'm totally with you on that. And I will say, having Melissa and Lauren on the call from BitFocus is really nice because they see the group that's here today, and some of the things that we'll go over, we will need to ask 1 or 2 questions, and that could be a meeting with our admin staff. So I think it's really great that some relationship building through this as well. So that's really it, kind of a short one on the survey results. And that really is what my hope was today, was to like solidify who's gonna do what work. And if we feel at the end that it's just not the right fit, totally flexible. Christina, I'll hand it back to you.
Okay. It is, we are now at the point for a break. Do you want to go ahead, Daniel, since it's our break is scheduled for 3, to go ahead and go on to the 2025 point in time?
Yes. Yes, we do. This is not really, I don't have a presentation for this one. I just wanted to give a status update, which is that we have completed the official submittal of the sheltered point in time count for 2025 and the housing inventory count. So that's programs and people, and then inventory beds and units. And we submitted that to HUD on time. And we're currently in a data quality review process with our technical assistants through HUD. And Lauren and Melissa and myself and others on the admin team have a document that we're tracking some areas where we're looking to verify changes in counts from last year to this year. Very standard data quality process, and we're still working through that. And I have a timeline to give a presentation on the final results of that in August for the August meeting for this group. And Janelle reminded me that in previous years, we've actually paused August SPC for summer and vacation. So I wanted to kind of put that out there, I guess simultaneously. One, we're still working on the final data quality portions with HUD. And my plan was to present that to you all in August, those results. And also, I know that in years past, we've paused our August meeting for summer vacations, and people are busy around that time. Stop there. Thoughts on that? Questions?
Danielle, see Shauna with her hand up.
Oh, Shauna, please.
You were mentioning HUD a lot, and I'm just wondering, like with a lot of these reports that you are submitting and you're waiting for feedback on, there's been a lot of personnel cuts in HUD the last few months. So aside from the funding issues and the, the kind of drama around all that, is that impacting our work at all other than that, just with the lower workforce?
Janelle, feel like you want to take that one? And Shauna, Janelle, I think, yeah.
Oh yeah. We've seen some shifts in some of our contacts, but the main contacts that that lead the HMIS lead webinars have remained, which is so great that they're still there. There was supposed to be a HUD lead call today, but it got rescheduled for next week. So we're tracking that and making sure we still have the people we've been working with for years, which are great and really understand the community. So they're still there. I don't know if you guys are aware of this, but HUD actually uses a lot of consultants and vendors to complete a lot of their work. And so when we completed the Pitt and HIC, we saw definitely some delays. And normally we would be submitting it in April. We submitted it in June because they wanted to change a few things. So what I kind of anticipate is there probably will be some delays and some information coming out that's unclear that we'll have to wait for clarity on before we be able to act. And so I think that they're trying to still cover everything, but I would imagine that it's very difficult to be a HUD employee right now. I haven't seen impacts to the AAQ, which is basically their helpline. When we've submitted questions, we're still getting those back timely. So far, so good, but I don't know what's going to happen. It's really going to be in what they're funding in the appropriations bill, federal government, which is going through right now.
I'll add, and Ruby, I saw your hand go up. I will add, Shauna, one thing that I think immediately, like we saw this year, is normally the point in time count and the housing inventory count reports. These are our bread and butter staple reports we do every year. Are usually the deadline's usually mid-April, and that was delayed by I want to say 2 months. Melissa and Lauren are on the call. I think I've mentally blocked out some of that work for trauma on all the phone calls and coordinating, but I can't remember the exact date, but it was a lot later than our mid-April date. So I think we did see some lag there. If that is a signal of maybe some personnel staffing, hard to say exactly the reason, but we did have delays there.
Great, thank you.
Ruby?
Yeah, I don't know if I can add some context too, that the COC has seen some contract changes, some language in their contracts change. There's also, which I'm sure you might have already known about, there's also been some delays in announcements and stuff. So yeah, it's a lot of waiting game, it feels. Oh, and by the way, this is Ruby Romero speaking. And the other thing was that the COCs were in that peer sharing call, like expressing a lot of concern about receiving funding on time. And so there's potentially funding impacts. This is nationally though, not here. I will be clear. So that's all I wanted to add. Thanks. Thanks. Thank you.
Okay, is that it then, Daniel, for the 2025 point time count discussion?
Yeah, that's really it. I think the one lingering question I have in my mind is, and it's not on the agenda, so my apologies on this if it may require a motion, but do you, Christina, want to bring to vote or discuss a break for August for the SPC?
Do we have anything we need to discuss?
Insofar as like, do we have items for August?
Yes.
I think the things we're going to go over today, there would be, I would foresee a policy vote on data collection next month, but that can wait at the latest. That can be done in September. So I don't think that would hold us up. Also, sheltered point in time count presentation, that would be spilled over into September as well. I think that's fine. My professional recommendation is that I think we all kind of wait for that unsheltered count, and that's not happening until 2026. So I think we're okay if we pause those two things until September. But again, I'm just one person here. I'd love to hear from others. Ruby?
Yeah, I just saw a couple votes in favor, well, not votes, I would say a couple in favor of I think we should make maybe a motion to discuss this. Yeah, so I wanted to make a motion to take a break from the System Performance Committee in August. Is there a second? Or sorry.
Okay, is there a second? Yeah.
Any comments or discussion?
Yeah, this is Ruby again. I just wanted to ask if we're going to continue to do that work that we were just discussing in the groups or whatever, or starting to do that work in August then, or are we pushing that back to September as well?
Christina, we need to start that. We're already a little running behind on that. And so, yeah, I would say we'd still be working on it in August.
Okay, cool. Thank you.
If I could add, I think it's totally within the realm of like reasonableness to get a good portion of everyone working on those sections and reviewing that, and then in some good reading in August if you want. I think I can get in most of you all for a one-on-one. I think in the next 2 weeks, depending on schedules. I think I could get everyone. I could meet with everyone. I could try to meet with everyone before August. And if not, if some of you are open to meeting in August, even if we don't have SPC, I'm open to it as well, of course. Ben?
That was me changing lanes. Sorry.
Janelle?
Be safe, Ben.
Yes. Okay, so we've already had the discussion, so now call on a vote, right?
Oh, I see Janelle's hand raised. I just want to make sure I don't skip Janelle.
Janelle?
Oh, I just wanted to offer, yeah, thanks, Christina. I just wanted to offer if Daniel, if you needed some help kind of covering some of those one-on-ones that I can help divide and
get some of those meetings scheduled too. Need to help with that.
Thanks for that. Yeah, I think just scheduling them is, I can take the scheduling part, and then I think that's gonna probably just be the hardest part for us, is just, coordinating those one-on-ones. Thank you for the offer, Janelle. I might take you up on that.
Okay. I'm going to ask the group, we only have two things left on the agenda. We could take a break right now, or we could power through. I'm saying we got about 20 minutes left. What do
Point
you
of
guys
order,
think?
did we actually vote on the motion?
Oh, thank you. No, we did not. All those in favor of going ahead and adjourning for skipping the month of August, please let us know. Say aye.
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 Okay. Any abstentions or denitions or nays? Okay, hearing that it passes unanimously. Thank you, Ruby.
Of course.
Next, what do you guys think? I'm open to just consensus discussion. Do we need a break, or should we just pass on through to the next couple of things that we've got left, which is HMIS user survey and HUD data collection policy?
Pass on through.
Yeah, let's keep going.
All right. Well, Daniel, you're up. HMIS user survey.
Perfect. Let me pull up get things ready here. A little bit of patience. Okay. Thanks for hanging in there, everybody. Here we go. Is that coming through?
Yes.
Yes.
Okay,
Yes.
so there's been some discussion on this topic, and there were some questions over the last two committee meetings, and so I've gathered those questions together and then brought together for what I'm hoping here is a discussion, and then a temperature check on where you all want to go with this topic. And I've got some recommendations for some next steps. Not trying to be cryptic here, but I do have a slide kind of walking us through all this. So what I want to do is review some of the local authority that we have on demographic data collection, and just answer those questions that we've had about this, and then focus on gender and some other demographic elements to the 2026 HMIS data standards. This is text heavy, and I'm sorry about this, but I did want to just make sure that you all saw the text. And I did send you this in a text format, Christina. It should be in your top of your inbox. If you would like to read along with this.
Yes,
So,
it's there. Thank you.
yeah, okay, great. So we got a HMIS data standard manual update recently. Not unusual. HUD puts out new manuals usually every 2 years, but it's varied over the years on when they publish that. And what we know was going to happen, we did see it in the official most recent version update. I'm going to hone in here on the data element 3.06, which is gender. So for assessments, one of the things we've asked for years and years and years is if folks are willing to identify their gender, and then we collect that and we use that for measuring outcomes and impacts for different groups in that spectrum of genders. And HUD is put in writing that they are going to be retiring that for the 2026 data standards, which I know Melissa and Lauren are on the line. Typically, they come to us in October. So we don't have a lot of time between now and when these are likely to go into effect. And here's the kind of the list of things that I saw in the changes. For the name, there was guidance in how we collect name, how we ask people, sorry, let me go a little slow here. For every data element in the assessments that we ask those coming into these different programs that you all are, aware of, property housing, permanent supportive, we ask a series of assessment questions, and one of them is your name. And in that guidance, there used to be in the old version guidance on dead naming, and I don't know if there's anyone out there that wants to define that for the group. It's usually, if the scenario I've seen it more, if someone's transitioned their gender and they've also wanted a name change that aligns with their identity. HUD used to say, don't use their old name, use the name that clients give you. And that's been removed from there as a recommendation from HUD. Social Security, that's a data element. It's still going to be collected like name, but it used to in the manual call out federal protections. If you did not give your Social Security number, they've removed the language saying that those protections are in there. Now the law remains in effect, but HUD has stripped that, elevating that info to case managers that they could explain that to clients. So that's not in the new manual. And then race and ethnicity, and this one they actually add a text field. But what they have done is they've removed links to client-centered data collection guidance for gender and for race and ethnicity, which were prominent in the last version of the data standards manual. Now, they did add they supplemented a 4-page guidance, supplemental guidance to one paragraph now. It's distilled down into one paragraph that does say, attempt to make a person-centered approach to data collection. Really not any less detailed than before. And then gender is slated to be retired. So they're not requiring that we collect gender, and they're not going to require the data collection of sexual orientation. Primarily, we collect that for youth and young adult programs. And then some updates for the veteran serving data element, V7. This is mostly affecting veteran programs like SSVF. And that's more just like an improvement there. If you are seeing this the way I see it, it looks like they're rolling back in accordance with the federal administration's focus and their initiatives on gender identity, and there's an executive order on that, and I can get you all that info if you haven't. This is really where that's coming from, or spawning off from. And so that's the background of where we are and what this manual is saying we expect with the new data standards. And I'm bringing this to the committee because if we don't collect things like gender, and I'm specifically looking at that now, and or sexual orientation, we risk gaps in measuring program outcomes by things that we have said we were going to measure, and that we're beholden to measure at the state, for state reporting and for local reporting, and in the impacts and outcomes that we've said we're going to measure at KCRHA in our 5-year plan. So if we follow HUD's direction here and no longer require that, we'll really be put in a hard spot on measuring the things that we said we were going to measure in the communities we said we were going to measure to improve housing outcomes for all populations in the Seattle-King County area.
Yeah.
I'm going to stop there. Questions so far on what I've been bringing up? Anything I can clarify for you?
This is Christina. And Janelle, this goes back to maybe history, but I thought 5 or 6 years ago, maybe longer, the King County ruled our leadership ruled that they wanted that data collected. I just was looking back in some old notes and I saw a reference to that. Did our King County officials already say they wanted that anyways in the past?
For which fields? Field or fields?
Yeah, for the around the things that HUD no longer wants to collect, like a
Gender.
person's gender, that kind of stuff. Yeah.
Sexual orientation.
Yeah, so for the HMIS fields that we have locally, you guys, you all make the decision of what locally we are collecting. And so you guys will vote and tell us how you want it to look in the system. King County electeds a long time ago, they wanted us to add a few custom things, but those were around where people are their neighborhood or their city that they were living in. 2 years ago, in our last data standard changes, we had sexual orientation that we had just collected from the youth, but this committee voted to put that on all the program screens so that way we would have that collected there. And then I'm trying to remember if there was one more that you guys had voted on and had approved. But with all of the changes that HUD is proposing of not collecting the data, we can still collect it. There is what they have been telling us, a local option. And so you guys can set what we collect, and so we can continue collecting gender. We can continue collecting sexual orientation. We can continue collecting all of these pieces. We don't have to change them, but we would need you. What's weird about it is that we need you all to now vote on those to continue collecting those, if that makes sense.
Yeah, because I was just happened to be looking at my notes and I want to make sure, I know we have to vote on that, but I'm also wanting to make sure that we're doing what our council members want as well and not miss anything there too and not be stepping, you know what I mean? And I knew they had said they wanted some stuff and I just had question marks there. And so, yeah, no, I'm definitely interested in entertaining a motion to keep including gender identity questions with the scope of the questions we ask. And I know Daniel has a very much more elegant way of saying that.
No,
yeah.
I like plain spoken. It's great.
I have a quick question. So I know that in the HUD rule, like you were just speaking right here on the screen, it says that we can establish HMIS data collection guidelines beyond the HUD's minimum requirements. I just want to make sure, because like I'm in full support of keeping these as a data collection point, and I'm thinking about how, you know, there's one thing that is obvious is that they're really trying to kind of diminish the intensity of federal programs, I guess you could say. And so it is important to be local and think locally for our area. And we have the ability to do that with the COC, and that is a good thing. And then just also wanted to highlight that a lot of the things that you were saying, Daniel, about the like shared data requirements or whatever, the collection requirements that are gone now. Like there's been a lot of things from the HUD website that has been removed. That's been another impact that I've noticed. I don't know if others are experiencing that, but when I go to find resources, I can't find them on the HUD website. So I'm hoping that we do have like downloads of all of our records and stuff like that for the HMIS stuff, just like the policies and stuff like that.
Yep, we have, and I have, we have in collaboration with other HMIS leads, we have a repository. So if we need to look at something and you can't find it, let me know and I can look to see if we have it in our library. I'm pretty confident we'll have it. If you're looking for it, I think we'll have it.
Yeah.
Shauna?
That's one of the,
Oh,
just a quick follow-up. That was one of the first things that we did when things started to not look good on the website. So those have all been downloaded. And then if you're looking for something, just a quick note, on our BitFocus HMIS website, we were linking to the HUD website. We've removed that and we have hard copies now of all the current manuals up on our website. So if you guys are looking for those, you can find those. So I'll get those to you.
Awesome. Thank you, Janelle.
Yes,
Thank you
Janelle,
for
thank you.
that.
Yeah, that's great. Sean, I was thinking you might have something here because this kind of it blends into what you were saying earlier. Yeah.
Well, no, I just heard someone say we need to vote, so I was gonna make a motion that we continue to collect the data that
To
is not,
continue. I
yeah,
love the enthusiasm. If I may, I would feel as the administrator, I would feel like I didn't do my part in making sure you had all of the knowledge here that I
okay.
with you. I want to be as neutral as possible. Also know that we as just someone who measures this performance, we've said we were going to do it. So I want to make sure you know that what's involved here. But love the tenacity, Shauna. I think you still can be the first to make the motion. I wanted just to make sure that everyone was aware. Yes, we can set local HMS data standards, and right there is the federal code that says that we can. And then is there a risk of falling short on reporting requirements if we don't, if we just follow HUDs? And I said it earlier, but yes, we have in our contracts the performance that we're going to be measuring, and that includes reporting on outcomes for gender and reporting on outcomes for youth and young adults. And that includes that sexual orientation data element. So if we did not collect that, yes, we would be not meeting our reporting requirements. So that would put us at risk of non-compliance for our reporting requirements.
And I would add that would be, for, in addition to our local requirements, our ILAs or master service agreements. So we, locally we have to continue to collect those.
Thanks, Janelle. And afterwards, I have it in the notes section of the presentation, but I can send it out. I went through all those documents and I have the exact pages listed where you can see where we have said we were going to report on gender. So you know exactly where to look to say, you can verify that that is what we've said we are, and that's what is at risk of not reporting on. So I do have that listed out, Janelle. I'll send that to you as well so you can see that.
This is Christina again, and I don't know, this is like another similar type question, but have we ever asked our I'm gonna use the word rulers, like, cause thinking about the federal government, but our politicians, if there was anything else they ever wanted us to ask about that would be helpful for them in their policy making decisions, etc., that we might not be asking?
I think
and that might be a good when Ruby and Dorsal go to the main group, might be a good question to ask them. Is there anything we're missing that they would like to see us collect?
Yeah. Christina, does this make sense? Like there's this issue we have in front of us. And then I think
I'm sorry.
At any point, actually, we can be gathering that input. I mean, you're all our representatives and delegates of the communities that you serve. At any point, we can make a recommendation on data collection. So I don't think we have to feel pressured because of this particular example that we're seeing to do it all at once. But I'm also neutral on that question. But just letting you know, I don't think it's a either or. I think you can do this, and then later you can do that and talk to other stakeholder groups, and we can kind of keep revisiting that.
I think it'd be a good thing to put on like a yearly calendar to like do and stuff. But I always apologize. I'm a big squirrel. I get off tangent, my brain injury. But any other discussion before we go to a vote?
Tamara?
Oh yeah, this is Tamara. I just wanted to mention, and I think I mentioned it to you last week, Daniel, about the first iteration of the audit tool that I had been working on regarding applying a well-being analysis to our homeless response system. And I've have just generated the first round or the first draft of that also includes like what from my own biased perspective of the homeless response system, what our monitoring priorities should be, and the specific metrics and indicators of looking at the system across time and based on certain like psychosocial metrics that have not been considered in our history. So I guess that's what I just wanted to mention, but I think we're going in a good direction with this innovation, is my hope.
Thanks, Tamara. And I did speak with Catherine, who staffs the COC board, and her and I just had a discussion on the wellbeing metric, and I got her caught up on the most recent developments in the work plan, and it's still on the roadmap for updating our Seattle King County outcomes report. So yeah, hovering in the wings as you develop that more and more, and we get that into a state that we can integrate. So that's not off the radar, that's on the radar. Tamara, thank you. The last slide here is really just the process. I just want to make that clear here. My understanding and read of the charter is here, what we would do is we would make a motion to advise the COC board to then approve and maintain the current data collection for gender and sexual orientation. But I'm actually gonna defer to Ruby and Tamara and Christina on this one. If this doesn't seem accurate, this is how I read the charter.
I'm fairly certain that this is Ruby Romero, the co-chair. I'm fairly certain that the way that we've done it in the past is we voted on things here. I think I guess we'd have to review the charter and see exactly what the language is, because I felt that the HMIS committee could definitely vote on things, and that would be just recognized by the COC board. But maybe I'm remembering things incorrectly.
No, actually, that's how I remember it as well. I think there are certain things that the SBC has, I guess, final say or final determination about certain decisions. At least that's how I remember it too.
Yeah, and then we would just update the board.
Yeah.
Yeah, thank you for that. And I think what's probably important is just including the COC board. And I know, I guess, Ruby, you're on the COC board, you're the co-chair, so you're informed. I'm okay with the pivot here. I didn't want to make a misstep off of what I was reading in the charter on this. And my discussions with Kelsey, I think we can go for a motion and a vote, and if for some reason we had a misstep, and I think that's we could always go, we could always do like a online vote if we needed to, if for some reason this didn't
The charter is what part of the charter is concerning you? If you guys were discussing this, I want to make sure that we're bringing in Kelsey's expertise on that as we are reviewing the charter. So is it the System Performance Committee charter or the COC charter that you're speaking?
Yeah, this was in consultation with Kelsey. She's out today, and I wanted to double check with her on that as well. And so I didn't want to check with Kelsey, and I wasn't able to, but this is a safe process. But I think I know we have passed policies here. This one is just kind of a big one as well. I want to take into consider like kind of weight this a little bit. Just thinking about the current,
okay,
things.
Then I propose that we make a motion to, oh wait, sorry, we had someone else that wanted to make this motion. That we just make a motion to recommend this to the COC board, and we can elevate it to the next board meeting for a quick vote if we can just have like the recommendation written out.
That's my recommendation for this group, just because it is the visibility on this. I think it's important to have the alignment between the subcommittee here and the overall advisory board.
I mean, yeah, that's just the safest route, I feel like, at this point, if you're concerned about, if we can't contact Kelsey and we can't, we don't want to make a misstep, I think the way to handle it would be voting to make a recommendation. So if somebody wanted to handle that motion.
And Chanel originally motioned, so I would need a second.
Second.
I think
Ruby?
Shauna, Christina, yeah.
I think
Oh, Shauna?
Shauna
Oh, sorry.
motioned.
Oh, thank you.
Yeah.
Thank you.
I would second Shauna's motion. And this is Ruby.
All in favor of continuing the data collection demography that we're already using, please say aye.
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 All
Aye.
opposed or against, please make it known. Okay, motion carries. And then we could go ahead and I will, when we have the COC meeting, I will mention it in the update that we voted on this.
And I will elevate it to the board to be voted on officially by the next meeting, or not by the next meeting, at the next meeting.
Great. Okay, I'm looking for. Okay, we have one more thing, Daniel. Go ahead and go.
Oh, yeah, okay. Up there. Sorry, I'm like so happy. I'm a little bit like discombobulated. I need to look at my agenda. What did I have on there? Nothing else matters. No. Let's see here. Oh yeah, this was just actually, Melissa, are you still on the call?
I am.
Do you mind kind of leading this this discussion point? You and I had talked about getting an early jump on the survey with the kind of the time we have left in the year, and some feedback that we had gotten from the committee last time.
Yeah. So I think that there was some concern in the way in which the HMIS user survey was conducted and has been conducted over the past couple of years. And so we definitely heard that feedback. And if we could, as a group, discuss, what are the best ways that we could improve the HMIS user survey process to get better results, right? To inform, the work that we might be doing. So the sooner we can talk about that, the more work that can be done on it. I think usually it's a fairly short turnaround time, which isn't really enough to make robust changes. So again, just if we as a group could think more about how we could adjust the HMIS user survey to be a bit more informative, that within this group, that would be great and super helpful for our team.
And I thank you for that, Melissa. And I see on the screen here we got Shauna and we've got you, and don't know if Lauren was able to stick with us here.
Yeah, she had to step away.
She had to step away. But I think Shauna, Melissa, Shauna, this is going to be kind of the key team here, reviewing and looking at that HMIS survey and then taking back that input that we got from members earlier in the year. And I foresee a meeting maybe with the three of us looking at that and then sketching out exactly what our timeline is and when we want to send it out and then what we need to get done before then.
Yeah, absolutely.
And then bring that update back to this group.
And I would
Shauna?
also, if BitFocus has the ability to do 10 minutes of tell us what BitFocus is about, what their mission is, what they do overall. I think it's been a couple of years since they've come back, have had that discussion. And I know I'd love to hear about, and let others, our newer members, hear what BitFocus, because BitFocus with Janelle and them have been around for they've been around for a long time. And so, yeah, I would love to hear what this provider does and stuff, if y'all would be able to do that for us in an upcoming meeting. And then I saw Shauna, I think I see a hand, but yeah, go ahead.
I just wanted to ask Melissa, Daniel mentioned earlier that it's usually towards the end of the beginning of the year or the end of the year that the survey goes out. Could you give a little bit about the timeline? I think, and the reason I say that is because, especially for smaller agencies, the end of the year is just a train wreck with year-end fundraising, finishing up contracts, executing new contracts. You know, it's almost a full-time job just executing the KCRHA full contract, not counting anything else. So I think if you've had limited engagement before, that timing and what's on people's plates might be an issue with that. Because I know I've failed to fill it out before, but just because by the time it floats up to the top of the box, it's like past the deadline. So I'm like, oh, all right.
I completely understand that. I know it's dictated by our work plan with KCRHA. I'm just taking a look at what we have for this year. I do think that we extended it out to start prepping for the HMIS user survey a bit earlier this year based on feedback we got from the SPC committee. And I think the time in which and when the HMIS survey is released is fairly flexible. We just have it, the whole project seems to need to be wrapped up. Let me see if I can find it real quick. We have a goal.
2 weeks, we usually keep it open, or we kept it open 2 weeks. Maybe recommendation for 3 weeks. I'm remembering, Melissa, most people fill it out within that 2 weeks.
That's what we have experienced. It's interesting to hear everybody else's experience and what might be going on. You know, I think there's lots of experience to be had and to be shared around HMIS user surveys. I do see here we would like to have it, you know, at least completed by November. In terms like it's closed, but when it's released, how quickly folks have to complete the user survey, it's fairly flexible. And I think we want to hear, you know, suggestions or ways of improvements, because I do think that some of the previous members noted that that may not be enough time. But we also know sometimes experience says that it is enough time. So it's just a collaborative approach. Would love to start working on it sooner.
Yeah.
Not to make too fast calls on it.
Yeah, it's just, I think, and this is why I'm on this committee, to be the voice of the smaller organization. You know, I'm the executive director, and I would fill out that survey, and I would be executing contracts, and I would be hosting our one annual huge fundraiser and doing our year-end fundraising all at the same time. So, you know, bigger agencies that have lots of departments doing different parts, yeah, it's not a big deal. So, I mean, early November is way better than December. I would say early November or then late January once people come up for breath. But it also is fundraising season from like September till end of the year. So,
yeah.
Hi, this is Ruby. I had a question about like rolling surveys, you know, like, is there a way to keep it open all year round and we only evaluate it one time a year, or is that not a possible thing to do?
From my perspective, it's possible. Yeah, functionally, that's totally possible. If that's the decision, we would make the survey, we could, you know, finalize logistics and whatnot. Happy to try, you know, lots of new ideas, you know?
Yeah, because I'm just thinking like maybe there's like a way to capture it, you know, essentially for lack of a better, or for being punny, a point in time to capture the actual like data or survey requirements or whatever. But then that way we could remind people, maybe, you know, not so often, but it would be like quarterly, a reminder or something like that. Would that be something that could help the smaller organizations, do you think, Shauna?
sorry, I missed part of that, Ruby. What was the last part of your question?
Oh, I was just curious if having like a rolling survey available, so meaning it's open to accept information year round, but they only gather the information one time for that like survey report kind of a thing, or do you think that would, and maybe people got notified, I don't know, quarterly or something like that? Do you think that would be helpful?
I mean, from a user point of view in the agencies, I would say the more important issue is the timing. Like, just keeping in mind what's on people's plates. From an administrative point of view, from HMIS and BitFocus, I think that would maybe be more work just to have it up all year round. Cause then, I don't know, I would just find a time of year that feels like it works for the majority, and then just make sure communication is clear, there's enough notice, enough time, that sort of thing. The problems we've had before are not necessarily with BitFocus, and KCRHA is doing great now, but for a while, it's like we'd get an email on Monday saying there's a mandatory training tomorrow at 1 p.m. I was like, well, my schedule is filled for the next 3 weeks, so I'm not making that. Just to keep in mind that different people have different bandwidth and different capacity and different number of people doing the same job.
Yeah, and I also think about some of the questions. It might be difficult to have a running survey for some of the questions, but it's something to keep in mind. Like, definitely, perhaps, we'll, I think, link up between Daniel, Shauna, myself, and any suggestions are totally welcome. And then we'll just put our heads together to see what makes most sense. And then we could just bring it back to the group for further discussion. But I think that's such a great point. I am an advocate for our smaller agencies. I love that you're bringing that perspective. Thank you.
Well, I know we didn't have a lot of agenda items, but I think a lot of substance to them. So I want to say thank you everyone for engaging on all of this, and I think I appreciate the motion and the vote today to continue data collection. I appreciate you all, seeing the value in that for the communities that we serve and getting people housed. With that, Christina, you want to close us out? I think that's all of our agenda items for today.
Is there anybody else that has public comment or anything else for the good of the order before we go? Okay, hearing none, we will see us all back in September, and y'all enjoy the rest of yours. Oh, go ahead.
I'm sorry. I do see a hand in the attendees. JJ?
Go, JJ. Yeah, thank you for catching that.
Yeah.
Oh, I think that's on me to get that. Just 1 second there. There you go, JJ. Should be able to unmute. JJ, is that coming through for you? It looks like on my end, I've given permission. There you go.
Am I on? Can everybody hear me? Thank you very much. I'm JJ, and I am on the work group for charter review, and I have been attending this particular meeting, all of the COC meetings, including the board, the council, and so on and so forth. And on the last meeting of this performance review, system performance meeting, at the end, I did raise my hand to make mention of something that I feel that is necessary to make mention of, is that Ben Mathewson was mentioning that, oh, well, some of these organizations data we don't really have, because like the housing authorities, like King County Housing Authority, Seattle Housing Authority, we don't have those data. I feel that it is good that if we are able to collect them from them, it will be our data collection is going to be broadened and more in-depth and more substantive, if possible. That's one of the points that I wanted to make. And for today that we are discussing about, when is the survey going to go out and how we collect the data? On one hand, I realize that all data is perfectly collected will never be happening. And I have done enough researches in the last 35 years to know that no survey is going to be perfect. And if we are going to wait for that moment to happen, I guess that we can shoot for the moon. That's a good perspective. But at the same time, I hear that we will all want to be, I heard you, Sean, mentioning about how smaller organizations have less resources and manpower to produce what needs to be done. And I also heard that at the same time too, that we want to make the most out of this data collection on this survey, that we're able to use the data very effectively, which is very important. I think that even though it sounds like that it is, so to speak, on one hand, it sounded like paradoxical that on one hand it needs to be done, but on the other hand, we cannot do it for the limitations that we have. I think that I would like to offer, just like Ruby was offering, is that can we, that's one point that I would like to make is, can we think outside of the box for a minute and see how we reach out to our own resources within ourselves, both in small organizations as in one committee, as well as in one organization, so that we are able to substantively collect data and in a timely manner, if at all possible. And this is all I wanted to say. And thank you very much for listening. And I wish you best. And I also want to commend that your participation, I hear loud and clear, as well as I find that the presentation of the organization of this particular meeting is very commendable because it's very well organized and very detailed. One small question that I have for Daniel is that I am hoping, I didn't hear this part, I certainly hope that you have this in mind, that you're going to meet with each individual to do their parts. And the question is, it's a rhetorical question. When are you going to have time to do that? It's very challenging with a full plate on your desk right now. And I'm just leaving that as a rhetorical question. And that's all I have to say today. And thanks again for allowing me to speak, and have a very good evening.
Thank you so much for the comments, JJ, and well received.
Anybody else before we go? If not, I'll go ahead and say, have a great month, and we will see you all in September. Thank you very much. Bye-bye now.
Bye all.
Bye.